your blood glucose level can drop below your target range if you skip a meal, if you exercised more than usual, or perhaps the type or amount of your medication needs adjusting. When this happens, your body doesn't get the energy it needs to function. Symptoms you might experience include headache, weakness, a cold sweat or clammy feeling, shakiness, hunger, irritability, and dizziness. If you ignore it, hypoglycemia can get worse, and you can pass out. You should discuss the best way to deal with hypoglycemia with your diabetes care team, but here are some general guidelines. If you experience any symptoms of hypoglycemia, check your blood glucose. If it's below 70 milligrams per deciliter, or if you feel too shaky, confused, or weak to check it, follow this procedure. Eat or drink something containing 15 grams of carbohydrate. That could be 4 to 6 ounces of fruit juice or regular soda, 3 glucose tablets, or a tube of glucose gel, 5 to 7 Lifesavers, or 8 ounces of low-fat milk. Rest for 15 minutes. Recheck your glucose level. If it hasn't risen above 80 milligrams per deciliter, have 15 more grams of carbohydrate. Once your blood glucose is in a safe range, you need to make sure it doesn't drop again in the next few hours. If your next meal is scheduled more than 1 hour away, have a snack of carbohydrate and protein. Be sure you write down your low blood glucose readings in your self-care diary. Your diabetes care team needs to know about them to determine if and where adjustments to your treatment plan are needed. If you have frequent or severe episodes, notify your diabetes care team as soon as possible. Wear medical identification. Carry a carbohydrate food with you at all times. And be sure to check your blood glucose before getting behind the wheel of a car. Finally, be aware that drinking alcohol and taking medications for diabetes may put you at risk for low blood glucose. You should discuss alcohol use with your diabetes care team to learn how to use it safely, and remember to eat if you do choose to drink. The best way to avoid hypoglycemia is to take your medications as directed, as well as following the other parts of your treatment plan, like eating the right amounts of food at the right times, and getting into a routine of physical activity. Don't forget to learn all you can about the parts of your treatment plan, so you understand how they all work together.
The problem areas were you were having some lows.
If you have ever passed out or have frequent or severe episodes of hypoglycemia, first, you and your diabetes care team need to figure out why. Then, you need to ask them if glucagon would be useful for you.
Glucagon is a very important part of any management plan with a person using insulin. It's important for them to understand what it is, and it's also important for them to incorporate a significant other of some kind that can be taught its use, because it can't be used by them, it's used for them. So glucagon is a hormone that's made by the body, but the
Glucagon is an injectable medication to be used when a person with diabetes has lost consciousness because of hypoglycemia. The injection works by helping the liver produce glucose immediately, which then enters the bloodstream to raise the blood glucose level.
Keeping each part of your treatment plan in balance and working together can be difficult. If parts of your treatment plan get out of balance, you could experience hypoglycemia or low blood glucose. Know the signs and symptoms of hypoglycemia and be prepared. Do the people around you, your family and co-workers, know how to recognize hypoglycemia and how to treat it? Have you kept a record of any low blood glucose levels or symptoms of hypoglycemia you may have had? Did you talk to your diabetes care team about ways to avoid this in the future? If you're taking medications that lower your blood glucose, Put some carbohydrate foods wherever you might need them. For example, your desk at work, the glove compartment of your car, the locker at your gym, and your briefcase or purse.